what was your feeling yesterday when you heard and saw Andrew Cuomo saying, "We are your future"? He was talking to you.
Yeah, well, Governor Cuomo's right. You know, what's going on in New York is going to be playing out all across this country, and we are underprepared. You know, we've taken some aggressive measures in Michigan, you know, with this novel virus for which there's no cure, for which there's no vaccine. The best tool that we have in this moment, because there aren't enough masks and enough tests, the best tool we have is mitigating it by just not being together. This virus can't spread from person to person if we're not spending time together. And so we've been really aggressive. We've been watching closely what's happening in New York. We've been working hard to try to get as much as we can out of the federal government and supplement it by trying to make deals with vendors all across the globe, because we've got a critical need. And what we're seeing in New York is going to play out all across this country. Michigan is now has the fifth most cases in the country. Wayne County, where Detroit is, you just described the hospitals, 3 of the hospital systems that are at capacity now. We are at the beginning of the curve. We're nowhere even near the apex. And so it is a dire situation right now. And that's why we're calling on our residents to do their part by staying at home. We are trying to pursue PPE everywhere we can, and ventilators, just like Governor Cuomo was saying in that clip.
You know, Governor, I was last in Michigan a few weeks ago. I don't know, it feels like at least 3 weeks ago, maybe more, to interview Joe Biden. And I was leaving New York to go to Grand Rapids to do that. And I felt like I was going from one place to a safer place. And now the situation in Michigan is catching up with what we already knew was happening in New York. I'd like to listen to Rob Davidson, who's a Michigan physician who joined us last night on this program from Michigan. Let's listen to this.
You know, the reality is we don't have the equipment we need. We don't have the personal protective equipment. We don't have the tests. I am routinely now over this weekend seeing patients that are almost certainly positive or could be positive, and I can't tell them. I can test a certain number of people. I can test people sick enough to get admitted to the hospital, or with immunocompromised status, or frontline healthcare workers with symptoms. But everyone else, I have to tell them, I'm sorry, we're not sure, we don't know, and we'll just have to send you home to self-isolate.
Governor, are you going to be able to use this federal legislation when Congress passes it to in any way address what the doctor was talking about?
Well, there's no question that additional resources will be incredibly important, but we need test kits. We need swabs. I asked for 200,000 swabs from the national stockpile, and I know that that is a critical need all across the country, and they're having a hard time fulfilling it. If we can't do the tests, we can't isolate the right people. We have a hard time anticipating and modeling what it is that we are in for and what we are going to project. You know, the University of Michigan is some of the finest brains on the planet. We've been working with them on some modeling, and the modeling that we were originally working with was very concerning. We are outpacing the concerning modeling that I just described. And so this is happening so quickly. And as Dr. Davidson described, we don't have the masks that our healthcare professionals need, or the gloves or the gowns, much less the ventilators when we have people that are going to need them. And so that's why we are pulling out all the stops. We are manufacturing what we can here. We are trying to contract with companies from around the world. And we are desperately asking the federal government to ramp up the testing availability and the PPEs from the national stockpile so that we can meet the needs. Our recent shipment from the national stockpile was enough to meet, for one of our hospitals, one shift. Not even a whole day's worth of PPE that's necessary, but one shift. And that's how able we are to meet the need and to protect our frontline workers, who are the true superheroes every single day.